Welcome back. Taking a look at some health headlines this morning, like a new study that shows the shingles vaccine may actually help fight against dementia, plus sleeping under a fan and children and screens. A wide variety here. And we've got WWL Chief Medical Correspondent Dr. Corey Hebert to break it all down for us. Good morning.
Good morning. Yeah, we actually have some good news today. So we have a study that was published in the journal Nature that was done at Stanford University that showed that if you got the shingles vaccine, that it could increase your chance of not getting dementia. So we looked at about 20,000 people, and over that period of time of 7 years, there was a 20% decrease in the amount of new cases of dementia. Now let's think about this. Why? It's because chickenpox, when you get it, it never leaves your body. It just kind of keeps getting reactivated, and that reactivation causes an inflammation, and that inflammation could lead to dementia. So if you have not gotten your shingles vaccine, this is the schedule, and the vaccine schedule is a little crazy these days, but this one's pretty straightforward. If you're 50 or older, you get 2 doses 2 to 6 months apart, right? And if you are immunocompromised, then you get it at 19 years or older. Now, it's very important because if you get this vaccine, it could prevent that chain reaction starting. We don't want to get that chain reaction to start where you are making these types of proteins that cause dementia. So and also, I don't know if you ever had shingles out there, but it's painful, it's disfiguring. So go get the vaccine. It's really important. Go get the vaccine.
That's an interesting study. Yeah. Okay, we're talking about sleep under a fan.
Fans. Okay,
good
so
or bad?
In New Orleans, man, everybody's like, oh, I sleep under a fan. Oh, that's why I got the runny nose. Well, believe it or not, that's kind of true, okay? Now, I want to be very clear about it, though. Anytime that you have a lot of air blowing directly on you and you are under it and it's, blowing in your face, you're evaporating all your moisture, you're getting your nose dry, your eyes dry, your mouth is dry. It sets you up for allergens to get into your nose, and if it's spinning the whole time, then allergens are being kicked up. So what do you need to do, right? We need to get air filters in our house. You need to put it on low. It shouldn't directly blow on you, and you should use some sinus irrigation if this is happening. So the fan can theoretically cause a problem. Also, air conditioning. We don't want cold air blowing directly on you as well, because that will also dry you out, and I want you not to put it below 68 degrees. I know some people like theirs freezing cold, some people like theirs hot, but just as a constant, any kind of air blowing directly on you, especially if you have allergies, especially right now with the pollen counts being so high, can cause you to have some problems. So the old thing is actually true.
Okay.
Yeah.
A lot of people are probably going to be sensitive to that, whether the fan or not, but maybe like a box fan in a different part of the room.
Yeah, like where them fans at?
Something like that.
I couldn't help
Couldn't help yourself? No, okay.
All right, anyway. All right, so I got one more thing. I was on WWL radio the other day, and they were talking about child abuse, and it's a long story that they had a teacher that was putting Band-Aids on people's mouths, okay, little kids, right? And so I just said something on the news that said, I basically said that the way that our brains now, the young kids, their brains, because of screen time and interaction with social media from such a young age, they fundamentally process things differently. So when you want to discipline them, it's going to be different. And there was a bit of an uproar saying brains are the same. It's not, that no brains have changed. And I did not say brains change. I said the way that young people process things in their brain is very different. So if you don't believe that, go look it up, okay? Because if you want to connect with your child, you need to recognize that. Beating them does not help, okay? But these are the things I want you to see. There are some movies out there. They're called Screenagers, Screened Out, Childhood 2.0, The Social Dilemma, which is one of my favorites, and The Great Hack. I want you to sit down and watch all these with your child so that you can recognize, as well as your child can recognize, that you're not trying to just take their phone. You're trying to give them some self-control so they don't go down the road where they're addicted to these phones. Because you know, as well as I do, when you're a parent and you say, don't get on that phone, the first thing they want to do is get on that phone. So we know that doesn't work. We want you to talk to them so they can make that decision by by themselves and also, with you a bit.
Yeah, I want to go check those guidelines too that have been released about how much screen time per age,
Exactly.
different years. I mean, it all breaks it down there for
Absolutely.
you.
It's a big thing. So watch your kids, man.
Get outside and enjoy the weather, Go do something outside. All right. Thank you for this. We appreciate
Thank you.
And if you'd like to review any of these health headlines or get more information, maybe the list of movies there, just visit our website, www.tv.com.